name is Elise Maynard, and I am a part of the Doctorate of Physical Therapy program here at Grand Valley.
And my name is Nicholas Stevens, and I'm a student in the Master of Athletic Training program here at Grand Valley as well.
Our case study title is A Downward Spiral, a Case in Homelessness. Our patient's name is John Jones, and he is a 36-year-old male. His chief complaint is, I'm having trouble breathing, and I generally just don't feel well. Plus, this cut on my arm really hurts. Together, we decided to include a nurse, a social worker, a psychologist, and a physician into this case. The primary learning objectives that we have chosen were values and ethics, as well as team and teamworks. Values and ethics is about individuals of different professions working together to maintain a climate of mutual respect, as well as shared values. Teams and teamwork, on the other hand, is about applying relationship-building values and the principle of team dynamics to perform effectively a treatment plan, deliver it, and evaluate a patient population-centered care. Additionally, we aim to promote population health programs and policies that are not only safe, timely, efficient, and effective, but also equitable.
So a little bit of background on our case. Mr. John Jones is a 36-year-old male. He was happily married with 2 children and had what he thought was a pretty stable life and job. But suddenly, however, he was laid off, and as a result, he fell into a deep depression, started to become an alcoholic, and even took up smoking a half pack of cigarettes a day. Eventually, all the stress built up within him, and he became more angry, and this angry behavior led him to physically assaulting his wife. Unfortunately, he soon became divorced and lost custody of his children because of this. John was left unable to find a job or a consistent living arrangement as a result. Initially, he lived with various family members and friends, but his heavy drinking and anger only worsened, which led everyone that he stayed with to ask him to leave. Eventually, he ran out of places to stay, which led him to sleep in the park homeless. As winter arrived, he stayed at a local homeless shelter for the night, run by a church, but was forced to leave by 6 a.m. each morning. There was no mention of how John found money for food, nor does the case state if his friends and family helped him eat. Due to his job loss, John developed depression and became malnutrition, amongst other things, which in turn affected his ability to heal properly.
This is important and pertinent in John's case because throughout his time being a homeless man, he had a history of untreated medical conditions due to a lack of proper health care and inability to afford medications. He acquired various conditions that worsened over the course of a few weeks and developed into a sinus infection. He suffered from a cut on his shin that became infected due to poor hygiene, which later developed into cellulitis, and was also assaulted by teens and therefore treated in an emergency room on multiple occasions.
One day, John was approached by a local outreach team, and they offered him a blanket and some food. Due to his depression and being ashamed of his current state, he didn't make eye contact with the team, nor did he really communicate with them. After they visited with him for a few days, however, John opened up and told him that he had been experiencing shortness of breath and had a cut on his arm. Upon further examination, the team found that the area surrounding the cut was red and edematous, and there was a moderate amount of purulent pus draining from the wound. The team observed that he walked with a slight limp, was tender to palpation near ribs 4 through 7 on the left side, and was uncontrollably shaking due to feeling very cold. Upon further evaluation within an emergency room, some of the vital signs that were taken include the following. His temperature was 100.7 degrees Fahrenheit. His blood pressure was 140 over 89 millimeters of mercury. His heart rate was 125 per minute. His respiratory rate was 24 breaths per minute. His O2 saturation was 94%. And his perceived rate of exertion at rest was 5 out of 10. And his capillary refill time was 3 seconds, all of which are outside of normal limits. Some of the further lab findings include a white blood cell count of 15,000, a bilirubin measure of 2 milligrams per deciliter, and a BMI of 17.2, all of which are also outside of normal limits.
After reading this information, Nick and I were asked about some of the key pieces of information that we uncovered from this scenario. Together, we decided that the key pieces of information were in his history, things such as his alcoholism, his inconsistent housing situation, and lack of healthcare in general. Additionally, we found various signs of infection that were because of his cut and therefore his infection. These signs of infection included purulent pus, red edematous tissue surrounding an untreated cut, a fever, high blood pressure, an increased heart rate, an increased respiratory rate, as well as a decreased oxygen saturation. With this being said, we knew that John needed immediate medical care. But we also know that this wasn't going to be a walk in the park for John. Not only would he have to struggle to pay for this care, but he would need more help getting his life back on track, physically, emotionally, mentally, and financially.
The next question asked how we decided which professionals to include in this case. So we decided to include a nurse, a social worker, a psychologist, and a physician. We chose a physician to complete the initial evaluation and refer to other professionals as needed. We chose a nurse to help with general maintenance and to help treat John's acute issues. The social worker we chose to help advocate for John, point him in the right direction with financial help, living situations, etc., because that was a very large aspect that attributed to his depression. And finally, we chose a psychologist to help him work through all the emotional and mental trauma that he has experienced with the past couple of months.
When thinking about how an interprofessional care team could best serve John and his needs, we decided that this main reason was that this team could look at John holistically. Each member of the team brought a different expertise to the game, and therefore, within their scope of practice, they could help treat John under a fresh lens. An interprofessional care team best served John because alone, one professional would not be doing him justice. While they may be able to help his acute issues, they would fail to evaluate and take his mental state of health into account. Without someone who can guide him through society, he may just fall back into the same way of life, being homeless, without a job, and without proper medical care. But together as a team, they're able to help John get all the different facets of his life back together, allowing him the best chance to heal and take his life back. They wouldn't be able to do this without working together. For example, whenever one professional had a question, someone else was able to answer it and help create the best plan of care that fit John's specific needs.
Finally, the last question asks us to fast forward 1 year to kind of predict how his health has changed. What type of care providers do you think this patient's been able to connect with, and what value did an interprofessional collaborative team provide John? In 1 year, we predict that John's health has drastically improved. He's no longer struggling with any acute issues or infections. He has a BMI that has increased to 25, and his vital signs are all within normal limits. John has been able to connect with his psychologist and establish a primary care physician. He now regularly visits his PCP on an annual basis for general checkups to take care of any issues that might arise, and he sees his psychologist once a week to discuss mental health and general well-being.
By having a collaborative team, John was able to receive quality of care that addressed all of the unique issues that he was experiencing. The collaborative team was able to communicate often about John's status so that they were all on the same page for his plan of care. Plus, they were able to help recognize areas in which required further assistance. The collaborative team was non-judgmental and unbiased, and therefore was able to give John the help he needed regardless of his unfortunate past and medical history. Moving forward, they were able to help provide comprehensive care that had John's best interest in mind and ensured that he was able to follow through with a realistic treatment plan if he wished. Together as a team, they upheld high ethical standards and gave their patient and each other respect. They saw each role on the team as equal and beneficial to one another. They worked together to evaluate him, develop a plan of care, and implemented it. And together, they saved John.